South Africa is waking up to a new reality after the country's president declared a national state of disaster. Deborah Patta has the latest from Johannesburg.
Up until now, Africa has had the luxury of watching the spread of the coronavirus unfold elsewhere in the world, almost in slow motion. But that's about to change as more than half the continent now has cases. And most of these have been brought in from the US and Europe. But there are also reports of internal transmissions. And here in South Africa, people are beginning to experience what others around the world have already dealt with, getting used to a new normal. Stringent measures have been implemented in South Africa, including a ban on travelers from South Korea, Iran, many European countries and the US. Schools and universities have closed and gatherings of more than 50 have also been banned. Many other African nations are issuing strict travel bans, while Kenya has suspended all travel from any country that has reported COVID-19 cases. Perhaps the reason Africa is responding with such tough measures is that this is a continent that is no stranger to deadly infectious diseases like Ebola. Hardest hit, the Democratic Republic of Congo, only now starting to emerge from an 18-month-long Ebola outbreak. Many African countries have fragile health systems that will not be able to cope with the rapid spread of the virus, and the poor will be hardest hit, sometimes having no access to running water and living from hand to mouth. But on the upside, experts also say that the experience of dealing with epidemics such as Ebola will be critical in tracing and isolating cases as authorities work to slow the spread of the disease. Perhaps Africa's lack of relative connectivity has given them some weeks in which to prepare. In January, only South Africa and Senegal had laboratories that could test for coronavirus. Now, almost 40 countries have such facilities. Deborah Patta, CBS News, Johannesburg, South Africa.